If you've ever experienced a sudden, sharp pain in your leg muscles, a pain so sudden and severe it can wake you from a sound sleep, then you know how uncomfortable and disruptive leg cramps can be. Hi, my name is Dr. Frank Altenrath, and I'm a corrective care chiropractor in Cresskill, New Jersey. And in this video, we're going to dive into the topic of leg cramps. We'll explore what causes these leg cramps, the anatomy behind them, and most importantly, we're going to share the best stretches to relieve them immediately and also to prevent them. So whether you're dealing with leg cramps from exercise or dehydration or other factors, we've got you covered. So let's get started and find some relief. So let's talk about now the anatomy of the muscles that are involved in these cramps that we're talking about. And to be clear, we're talking about now the muscles of the lower leg specifically. This portion of the leg, from your ankle to your knee. So this is the region where most of you would be familiar with. You wake up in the middle of the night from a sharp pulling tightness in that lower leg. It makes you just jump out of bed. So the muscles that are involved with these cramps are mainly the two muscles, your gastrocnemius, and your soleus muscle, collectively known as the calf muscles. There's another muscle, a smaller muscle called the plantaris. We're not going to worry about that one. So mainly the gastroc muscle and the soleus muscle. Now these muscles are going to be stretched a little bit differently because one of them, the gastroc, is a two-joint muscle, meaning it crosses the ankle joint as well as the knee joint. And the soleus muscle is a one-joint muscle. It only crosses the ankle joint. So the stretches, when I show you them to you later, will be a little bit different for the different muscles. So the gastroc is the major bulk of your calf muscle. It starts at the back of the knee, the medial, outside, and the inside part of the thigh bone, the femur, and then it goes down and attaches to your Achilles tendon. That makes up the bulk of your calf muscle. The soleus, the one joint muscle, which only crosses the ankle joint, runs underneath your gastroc. So those two muscles combined form what we call the calf muscle. And strains and cramps are the most common condition affecting the calf muscle. So let's talk about symptoms of a leg cramp, which you probably are all familiar with. It's an episode of sudden pain in the muscle of the leg due to an involuntary contraction of the leg muscles, which means a shortening of the leg muscles. Usually happens in the calf muscle, or it could happen in other muscles as well. For example, the thigh or the feet can be affected. These cramps can last a few seconds or up to 10 minutes. The thigh muscle cramps last the longest, and they often happen at night while you're sleeping. So what are some possible causes of these leg cramps? Well, the first thing we have to look at these days with so many people on medications is things like statins for cholesterol, high cholesterol, or high blood pressure medications. These can cause muscle pain and cramps, so be aware of that. Another thing could be a diet that's lacking in potassium. Decreased potassium levels, calcium levels, and magnesium levels can cause cramping. Obviously, tight muscles or overexertion can bring on leg cramps, as well as dehydration, which could come from overexertion. As you get dehydrated, you have decreased levels of salt, and that will create cramps. You can also have things like a pinched nerve in the low back, or nerve damage from diabetes, which can cause cramps. As we age, the tendons shorten. The tendons connect muscle to the bone, so as they get shorter with aging, that can cause a pull on the muscle and cause cramping. So keep these things in mind as possible causes for cramping if yours just do not go away or persist. So in most cases, leg cramps are harmless and there is no identifiable reason for them. However, they can sometimes indicate an underlying health condition or disorder such as diabetes or something called, for example, compartmental syndrome or compartment syndrome. This is a painful buildup of fluid around a muscle, for example, in the calf. If you have something like, there is something called acute compartmental syndrome, which happens after a severe injury or after surgical complications. This would be a medical emergency that would bring about severe pain would require immediate medical intervention. But in general, if these cramps persist, meaning they keep coming back, or they last longer than 10 minutes, it's recommended to go see your doctor. So the treatment for these cramps could be a few different things. So if, for example, if you have cramps that are starting because of a serious disease, like let's say liver disease, and you have cramps from that, you may be prescribed muscle relaxants. But for the most part, the treatments are going to be stretching before bed, because most of the cramps do happen at night while we're sleeping. So we're going to now go into the stretches to relieve the pain immediately once they occur, these cramps, and also to prevent them in the future. So the first stretch we're going to do is, if you feel that cramp coming on at night, you're going to sit up or lay back, either one, and take your toes and start pulling them towards your body. And hold that for 10 seconds or more until you feel that pain start to dissipate, just to go away. So starting your toes in a neutral position, bring both of your feet up towards your body and feel that stretch in the back of your legs. Again, pull the feet toward the body. If the pain is in the right foot, you can do one foot at a time, or only the one that's causing pain. But again, these stretches are going to be also done for prevention, so you can do these at night before bed. Hold them for 10-15 seconds and then relax. Bring it back for 10-15 seconds, up to 30 seconds. Hold it there. Feel that stretch in the back of your legs and relax. Now, to make this stretch more effective and deeper into the muscle, we can bring it to the next level where we take a band like this, or you can take a rolled up towel, put it behind the back of your foot, and pull your toe towards your body. And you really feel that much more effective, much deeper. Hold that for 15-30 seconds and relax. Pull back, hold it, and relax. And you could do one foot or you can do both feet for prevention. But if you're having the cramp, you can do it on the leg that's hurting and then relax. But again, do both feet together simultaneously if you want to do it for prevention. So the next stretch, we can do it standing. Same muscle, the gastroc muscle. We're going to stand against the wall with one foot forward, one foot back. We're stretching the leg that's behind us. So we're going to put the leg behind us and we're going to lean into the wall with our left knee and keep the back leg and heel down. Lean into the wall with your knee straight and you're going to feel that stretch all into that calf muscle. And in this case, you do one leg at a time. Hold it for 15-30 seconds, then rest. If I'm doing the other leg, same thing. The leg I'm stretching goes behind me. The other leg goes forward. I bend into the wall with my forward leg, and I stretch the back leg by keeping my heel on the ground and feeling that stretch. And that's for the gastroc muscle. So now, if we're going to stretch the soleus, which is the muscle underneath the gastroc, the second part of that calf muscle duo, we're going to take now the back leg that we were stretching before straight. We're going to bend the knee a little bit. So we're going to do the same thing. The other leg goes forward. The stretching leg is behind us. But we're going to bend the knee a little bit and then bend into that knee and keep your heel on the ground and feel the stretch in your calf muscle. With the knee bent at, let's say, 15 degrees, 20 degrees. Try to keep the heel down and feel that stretch. This is stretching the right leg, the right soleus muscle. Switching legs to do the left. I do the non-stretching leg is in front of me. The one I'm stretching is behind me. I'm going to bend the leg a little bit and then kneel into it, into the wall with my knee bent a little bit at 15-20 degrees. I'm going to feel that stretch in the calf muscle. So this is stretching the soleus muscle more so than the gastroc. So you want to do both. You want to start with the gastroc, which is keeping the leg straight. Then the soleus is where you bend the knee a little bit and you do the same stretch, both times keeping the heel on the ground. Looking at it from the side view, if I'm going to stretch my left leg, I'm going to put my right leg forward toward the wall. going to keep my leg straight, my knee straight, and I'm going to lean into the wall, keeping the heel of my left leg, the leg I'm stretching, down and feeling the stretch in the back of my calf muscle. This is for the gastroc. Now to stretch the soleus, which is the muscle underneath the gastroc. It's going to be the same setup. The only difference is I'm going to take this knee and bend it 15 degrees or 20 degrees, and again, lean into the wall, stretching that back leg, but keeping the heel on the ground as well. And I'll feel that stretch all the way down to my Achilles tendon. And that's for the soleus muscle. So the third way to stretch these muscles would be to stand on the edge of a step. So if you pretend this is a step in your house or a step anywhere, you would take your leg that you're trying to stretch and you would hang the heel off the end of the step and let the heel fall toward the ground. And you'll feel that stretch in your lower calf. And if you want, that's the gastroc. And again, remember the soleus muscle, which is underneath, you need to bend the knee around 20 degrees. So bend the knee a little bit and step into it as well, or let your heel fall as well. You'll feel this stretch a little lower, again, toward the Achilles tendon. And we can do both legs at the same time, of course. Let both our heels hang over the edge of the step and let the heels drop to the floor. And this is a great stretch for the calf muscles. So again, if you have a cramp and you can do this during the cramp, it'll help you immediately. And otherwise, do this every day, preferably before bed, to keep those muscles nice and loose to prevent cramps in the future. If you found the information in this video useful and you know someone else that's struggling or suffering with leg cramps, feel free to pass on the video and share it with them. Also, if you liked the video, smash the like button down below, tap the notification bell so you'll be notified of any new videos that we release, and consider helping us spread the message by subscribing to our channel. Until next time, take care.